do if you're having panic attacks? Well, the treatment of panic attacks depends on many different things. One is, do you have any idea what's bringing those panic attacks on? Do you have triggers? Have you had a sudden change in your environment? Is it something that slowly snuck up on you, or something that you have had just all of a sudden? Another really important way to determine how panic attacks are going to be treated is how disabling they are to you. If you are all of a sudden not being able to go to work, not being able to stay at home and watch your small child, not being able to go and visit friends or family, if you are no longer able to do your normal social functions and or not able to be able to keep up with your workload at home or at work, then that becomes very quickly something that is terrifying for people, because now not only are they terrified while they're having the panic attack, they're actually terrified that they're going to have the panic attack in an inappropriate place that might be problematic for them. And pretty soon they don't want to go out and they don't want to do anything. So when somebody comes to me and they're having severe panic attacks, one of the things that we try to look at is if they've been going on for a long time and they're very disabling, then we want to look at being more aggressive treating. What does that mean? Well, it's probably going to mean medication, because medication will work faster than lifestyle changes or food changes, getting better sleep. But a combination of things to address multiple facets, multiple problems with those anxieties can be helpful. For example, many people who have panic attacks are shaky and have heart racing. We can put those people on something called a beta blocker. A beta blocker is a medication that slows the heart rate down and can actually stop tremors. We use that in other medical conditions for the same reasons, but it can be helpful in a panic attack, because what happens is if you start blocking the body's response to severe panic, then the patient quickly realizes, okay, when I am having an anxious, panicky moment, I won't necessarily have the racing heart that makes me feel out of control. So that is one thing that you can do to help people symptomatically. Another thing that we can do is give people a medication. We can give an anxiolytic. Classic anxiolytics like Xanax, Ativan, Valium can be addictive, but if you watch that patient closely and it's appropriately used, they can be very helpful. You can also start out with Buspar, which is an anxiolytic that is not addictive. So that's a medication that can help to get the severe anxiety feelings to go away. And I usually put those people on those medications scheduled to begin with. In addition to that, you can try medications to help that person sleep. Getting a good night's sleep will help that person to feel better, make them stronger and better able to fight off symptoms of panic. So those are three measures that a provider, a physician, or nurse practitioner, PA can help you right away to squelch the symptoms of your anxiety disorder. There are non-medical things that you can do, but sometimes medications help to get control of the severe symptoms in a quick way.